Abby Johnson with WebPro News, coming to you from Blog World in Los Angeles, and joining us right now is Dr. John LaPuma of Chef Clinic and Chef MD. How are you?
I'm great, Abby. Thanks for having me.
You're very welcome. I'm very excited to talk with you about some of the issues regarding healthcare and social media. It's a fascinating area, but obviously the healthcare industry is very regulated, so it's a little bit difficult. So talk about some of the challenges for the healthcare industry in regards to embracing social.
You know, there's several different healthcare industries. It's not just one. And of course, there's the whole set of arguments that we really have a disease industry instead of a wellness industry. I'm here in part for physicians who really aren't participating in social media. And only about 8% of docs have even read a blog. Only about 3% of docs are on Twitter or have a LinkedIn account. There are about 500 hospitals that have YouTube accounts, 575 as of last month, but there are very few views of those accounts. And I think healthcare is struggling to figure out how it uses social media in a way that is not simply promotion and marketing, but also is about education and communication and eventually diagnosis and treatment.
Well, how far should it go? I mean, do you think it should get to the point where doctors and patients actually connect on Facebook and Twitter?
I think it should get to that point. I think it should. The great promise of healthcare social media is that it can open access to care to people who don't have it currently. And that's the huge problem in our country currently, together with healthcare's cost. I think that promise can only be fulfilled if healthcare learns from other industries. Healthcare has been behind, and especially physicians have been behind in social media. Patients are way ahead. But healthcare is behind because it's fearful of liability, it's constrained by regulation. Physicians especially, but really all clinicians, don't get paid for doing social media. It takes a lot of time, an enormous amount of time, to do well, and that time isn't compensated. And then there are the liability concerns. Although frankly, Abby, it's more dangerous to practice medicine than it is to send a tweet. So I do think we'll get to the place where the most useful role for physicians will be one that's delineated as curating top medical resources. Physicians do participate in social media, but it's actually kind of surreptitious. It's as patients in patient communities for themselves or their families. They are not currently participating as professionals, but a safe role for doctors especially, and actually for healthcare systems more broadly, and even for insurance and other parts of the industry that have powerful and respected brands, is to identify the wheat from the chaff, to identify those resources that actually have primary references, that are not unduly influenced by money or other compensation, and can be examined independently. Curating medical resources, curating health information is going to be the key role for physicians in social media. And I think there are a number of communities that are already demonstrating that.
Right, yeah, we were talking off camera about the Mayo Clinic Center for Social Media. They have looked into this issue several times, and they have said that social media in healthcare makes their interactions in healthcare more perplexing, and that it should complement or enhance them instead of complicating the process. So what are your thoughts on this issue?
Well, the Mayo Clinic has been a leader in social media. It had a terrific conference last month, bringing together leaders of social media and trying to figure out best practices. This is a time, Abby, of 1,000 flowers blooming. This is a time that people are trying many different things to figure out what works. And the magic of the web is that it allows the collation of those resources so that people can compare them. There's a website from Ed Bennett, who at the University of Maryland, ebennett.org, which has cataloged 40 different healthcare social media policies, which is a way to begin to think about how institutions should address their own concerns and regulations and liabilities and compensation from healthcare brands, and another 100 from non-healthcare brands. And I think And as you know, I'm lucky to be on a panel with Scott Monty at Ford and Shannon Paul at Blue Cross Blue Shield today. I think that healthcare can learn a lot from automotive, from entertainment, from marketing and communications, from brands that have used social media well to get closer to their customers, and in this case, create better relationships between doctors and patients. It's going to be confusing for a while, but I think what will emerge from it is the potential for both stronger doctor-patient relationships and for the kinds of do-it-yourselfness that has taken hold in our culture, which is, of course, a very American idea. It's a do-it-yourself means I can take better care of myself if I have the best information. And that's what we want to do ultimately as clinicians.
Absolutely, and you brought up an interesting point earlier that I want to point out about consumers. They have almost, and patients on the other hand, they've really taken this situation into their own hands by creating their own forums and even social networks to bring together this whole idea of healthcare awareness, basically. What are your thoughts on these issues?
I think patient communities are one of the real successes of healthcare social media. I'm thinking of 2diabetes.org, of 23andMe. Patient communities are where patients can feel free to express things that they don't feel free to express at the doctor's office. And the reasons for that are long, but the information is empowering. I think what those communities are missing and what we're seeing now with HealthTap and ShareCare and UserMeds are communities that are hybrids, where the answers are curated and that there's some intermixing of sponsored answers by healthcare brands together with independent answers from healthcare professionals. And I think we'll see more of that, especially behind firewalls, where that messaging is secure and then increasingly personalized.
So in the next, say, 2 years, where do you see this going?
Wow, that's more than a $64,000 question, isn't it?
That's right.
Yeah. In the next 2 years, I see the growth of these integrated communities. I see the growth more of patient communities. I see the stronger input of clinicians in those communities as a way to begin to catch up with patients. I see protected text messaging that's HIPAA compliant and one that physicians can use not just to communicate with one another about patients, which 70% of docs do now, even though it's not protected and not HIPAA compliant, but with patients themselves. And my own patients email me their agendas for appointments. They email me. I do weight loss and management in Santa Barbara, and they email me their diet records. I've had somebody tweet me a picture of a rash, but I sent them to their real doctor, their primary care physician, because I don't really want to do that. No, but there's a great story, which you probably know, of a woman who was written up on Slate.com and then got coverage from the Today Show, who posted a picture of her 4-year-old with a rash and a fever, who turned out to have Kawasaki disease, which is an unusual autoimmune condition, which was helped along by her Facebook friends. So I do think community can actually contribute to diagnosis and contribute to treatment. But the most important role for clinicians in the next 2 years is going to be to help individuals separate legitimate, traceable medical information, primary sources, WebMD is not a primary source, from ones that are not.
Well, it will definitely be interesting to see how all this plays out in the next couple of years. Thank you so much for talking with us, Dr. LaPuma.
It's a pleasure, Abby, anytime.
You're very welcome. This is Abby Johnson reporting for WebPro News.